where we stopped on the...
David Chagnovsky and his wife Nancy always loved to travel. While his job sent them around the world, his retirement gave them even more freedom to go where they wanted.
We just like to travel and see as much of the world as we could.
But David soon lost that freedom. He began feeling the need to urinate frequently, which often forced him to restrict even the simplest travel plans.
I have memorized every rest stop on 95 between Maryland and Sarasota, Florida.
David had benign prostatic hyperplasia, or BPH, a common condition in which the prostate enlarges and constricts urine flow, causing frequent and sometimes painful urination. The frequency affected David night and day.
There's no question that with BPH you lose sleep because you're getting up so many times during the night. Sometimes I would walk my dog and I would have to come back to go to the bathroom before he finished what he had to do.
After getting no relief from a clinical drug trial,
Mr. Chagnovsky, how you doing?
David consulted Dr. Michael Naslin of the University of Maryland Medical Center. Dr. Naslin told David of a treatment new from Medtronic known as TUNA, transurethral needle ablation.
The TUNA is a great procedure because it works better than medicine for a lot of men, and it doesn't carry the risk of surgery.
With TUNA, a catheter is guided down the urethra to deliver low-level radiofrequency energy to eliminate some of the enlarged prostate tissue. That reduces pressure on the urethra and improves urine flow. TUNA is an alternative to a surgery called TURP. During the TURP surgery, the physician uses an instrument to scrape away prostate tissue, requiring at least an overnight hospital stay, prolonged catheterization, and possible side effects.
The most significant advantage of the TUNA procedure for most men is the very low risk of sexual dysfunction, such as impotence and retrograde ejaculation.
TUNA patients usually go home the day of the procedure and return to most normal activities within 24 hours.
He can resume normal activities the next day, and the risk of side effects or complications over the long term is extremely low.
I was able to have dinner with my wife at home. I slept in my own bed that night, which relieves the anxiety. I was able to walk my dog that evening, so life was almost back to normal. And the same day I was having the procedure. Even after 3 years, you still walk by a bathroom and say, gee, do I have to use it? But the good feeling is, no, I don't.
This is Dave Lee reporting.